So beta 1 we already seen where it is present. It is present mainly on the heart tissue as well as juxtaglomerular cell, and we are able to see there is an increase in the heart rate whenever we are taking the beta 1 agonist. Next one, beta 2, where it is present. It is present in the bronchial smooth muscle as well as it is present on the blood vessel in the skeletal muscle. Okay, so where they are causing vasodilation, and in the smooth muscle they are causing the relaxation. So mainly we are using the inhalation route. Why we are using the inhalation route, just we had discussed. Okay, so inhalation of beta 2 agonist are the choice for the asthma. Reason, they are most effective bronchodilator. We're going to talk how they are going to be most effective. Minimal side effects when used correctly. Okay, when we are using the inhalation route, we are getting the local effect, not the systemic effect. So because of that, there is a less side effects. If we use the bronchodilator systemically, we are able to see the other, like you can see skeletal muscles will also get affected. Here if we use the non selective like adrenaline, isoprenaline, okay, so in that cases also we'll get more amount of side effects. Okay, so here why we are not using the adrenaline and isoprenaline frequently, the reason they are non-selective. Okay, because they are beta 1 as well as beta 2 selective. So because of that we are able to get the various heart related problem. Okay, so should only used as a last resort. Next one, beta sympathomimetic are fast acting bronchodilator. Okay, as we know, when we are taking through the inhalation. Okay, with inhalation you will get effect within the 5 minutes. So which effect you are able to see? Bronchodilation. So anyone knows the mechanism how, by which this beta 2 agonist work? Anyone knows? You already learn about the adrenergic system, right? In last to last semester, I hope. Okay, we'll see about it. So here this beta 2 agonist used cautiously in these patient on the hypertension, patient with the digitalis as well as the other heart related problem. Okay, so in this patient it should be avoided or need to be given with the precautions. Okay, so bronchodilation, how bronchodilation is stimulated by beta 2 receptor. Okay, beta 2 receptor which are present on the smooth muscle on the bronchi. On this smooth muscle this beta 2 drug will bind, and once they will bind with these beta 2 drugs, this drug will going to activate the beta 2 receptor, and the beta 2 receptor will start the production of the CMP. Okay, and this increase in the CMP will going to cause the bronchodilation within the bronchial smooth muscles. Okay, so increase in the CMP in the even not only the smooth muscle, they act indirectly also. This beta 2 agonist have two type of advantages. So because of that we are call them as a most effective type of treatment. One is a direct effect. What is a direct effect? They directly act on the smooth muscle. Second is indirect effect. Indirect में क्या करते हैं? They binds on the mast cell. Okay, remember this thing. So on mast cell also you will get the beta 2 receptor. Okay, so once this beta 2 agonist bind on the beta 2 receptor on the mast cells, what they will going to do? They will going to decrease the mediator release. So mast cell is releasing the various mediator, right? Histamine, thromboxane, and all mediator are released from the mast cell. So they will stop the mast cell release. So two type of advantage. One is direct advantage, another one is indirect advantage. So what is a direct advantage? They will dilate or they will relax the smooth muscle. Second advantage, they will decrease the activity of the mast cell. They will decrease the release of the mediator from the mast cell. So ultimately we are getting the more benefit with the beta agonist. So now we're going to talk about the mechanism of action. So here you can able to see the receptor. This receptor is beta 2 receptor, okay, which is present on the bronchial smooth muscle. So on this bronchial smooth muscle, our drug will bind. After binding with this receptor, what will happen? This G protein type of receptor will get activated. This G protein receptor will going to activate the adenylate cyclase. This adenylate cyclase will going to increase the CMP level. Okay, this CMP level will get increased, which ultimately activate the various protein kinases. Okay, and these activation of the protein kinases will cause further action. So which actions you are able to see? Decrease actin and myosin interaction. Okay, means they are deactivating the myosin light chain kinases or decreasing the contractile protein. Okay, so the interaction will get decreased, so ultimately contraction will get decreased. Next one, sarcoplasmic reticulum. They also have action on the sarcoplasmic reticulum. So what actions you are able to see here? Increase in the calcium uptake, means whatever the calcium get released during the contraction in this area, all the calcium again taken back into the sarcoplasmic reticulum. Okay, so more than this, they also have action on the calcium efflux as well as influx. So in these cases, this phosphokinases, sorry, protein kinases, what they will going to do? They will going to increase the calcium efflux. More amount of calcium will go out of the cells, as well as decrease the calcium influx. They are decreasing the calcium influx also. So ultimate effect, the less amount of calcium present. So if there is a less amount of calcium present within the cells, smooth muscle remain in the relaxed condition. Okay, so this is what the mechanism of the beta 2 agonist. Okay, so some drawbacks are also there that we'll also discuss. To abort or terminate attack only. Okay, as we know, the smooth muscle contraction occurs due to what? Because of chemical mediator. Okay, so whenever we are taking the beta 2 agonist, what we are getting? We are only getting the symptomatic relief. We are not uh, terminating the attack. Okay, we just treating the symptom. Like वहां पे अगर कुछ कंस्ट्रिक्शन है तो आप जब बीटा टू एगोनिस्ट लोगे तो क्या होगा? थोड़े टाइम तक आपको वहां पे रिलीफ मिलेगा. Okay, till this beta 2 agonist present at that location, so they are not aborting the, means they are not stopping exactly the whole event, they are just preventing the symptom. Okay, next one, not suitable for round the clock prophylaxis. Okay, we are not able to use this beta 2 agonist continuously. The reason, they are not able to reduce the bronchial hyperactivity. Okay, reason is here, what happens when we are using this beta 2 agonist for prolonged time, the mechanism will get reversed. There is a down regulation of the beta 2 receptors. Okay, the more amount of beta 2 agonist will use, or we can say the long term chronic use of that beta 2 agonist, when we are doing that time, this beta 2 receptor undergo the down regulation. So ultimately we will not able to get the beta 2 receptor